All righty then. Welcome back. This is Dr. Garais, MED120 for DAX. This is Monday, August 23, week 4. Next week is week 5 and our midterm exam. And yeah, let's go over the announcements about that and how the exam will go down before we hop into the digestive system. So next week, we're not on campus yet. It's this week is week 4. Next week is week 5. And if you look at, so of course, what's due this week, any module 3 items are due today, but what's due next week? You do the quiz, you do your medical language laboratory, but there is no discussion. I repeat, there is no discussion for due next week. So I put that message there so that you will focus on the exam. And the exam, there are essentially it's 50 items, multiple choice. And for the exam, there's only actually 2 types of questions that I could ask. The first type will be just straight up definition. And of course, multiple choice. And here's an example. Let's pick our first word and our easiest word. What is the department that will deal with my patient diagnosis of heart failure? And then I could put pathology, cardiology, neurology, and of course I'll expand, so on and so forth. So it could be a straightforward definition. Okay, like, so this is a way where I could give you the definition and then you give me the word, or I could do it this way. In the medical term, cardiology, what is the meaning of its root? Okay. That would be, is it study of? Is it doctor of? Is it heart, brain? All of the above, none of the above? You could go on. So that's one kind of question that's going to come out. And the second kind of question, which is kind of like, this is like a combination. The second kind of question is, of course, do you know the word parts? So I could ask the question in the medical term, cardiology, which of the following is the suffix? Okay, or which of the following is the prefix, if any? Which of the following is the root? Which of the following is the combining form? Now, the one that always tricks people, because they forget, remember, combining form is cardi plus a connecting vowel, whether the vowel is there in the word or not. So for this word, cardiology, the combining form is cardio. For the root, of course, is cardi. Prefix, there is none. And what's O? O is the combining vowel. And that's the worst I could do to you. So knowing that, knowing how the format of how the exam is, then you could pretty much figure out the entire exam by looking at every word that we ever went over in the last 4 weeks. And the majority of the words, if you look at your announcements, if you look at the first week, the first Zoom session, you click on that. Of course, there's videos. Right down here, these are notes for the first couple of chapters. They're like 5 pages of notes. And they pretty much broke down a lot of the words that you have seen in the last 4 weeks. So the scope of this exam, multiple choice, 50 items. It'll be online, meaning to say is you don't come to campus. Your exam at around 8:55 a.m. on August 30th will be in here. And it'll say week 5 actual exam, and it will have instructions. And the instructions will pretty much say, it'll look like something like this. Let me give you an example of what the instructions will look like. It'll say your midterm exam will begin at 9 a.m. promptly. And of course, it'll be posted August 30th. You will have 1 hour and 15 minutes to email the numbered answers only to me. So you email me, and of course you put your name in the email, and in the body of the email, this is all I need to see. 1, that's a B. 2, you like D. 3 is A. Whatever the answers are, and that's all I need. I don't need because in the past we had so many problems of people taking photographs, people sending Microsoft Word documents that don't open. So just an email, and on that morning I'll be monitoring it. So at 10:15 a.m. I will start I'll start, or as they come in, I will send you a confirmation. Now, if you don't get a confirmation, that means I never got it. Okay? So you text me, give me a call and say, hey, Dr. Garais, I sent it to you. And then I could recheck it again and then tell you if I got it or not. Okay? So make sure you get a confirmation that morning. Now, let's say for an example, for whatever reason, you couldn't finish the 50 item in 1 hour and 15 minutes. For every minute that it's late, I have to take off 1 point, because a 50 item exam can be done in half that time. Statistically, it can be done in half that time. 1 hour and 15 minutes, if you start on time at 9 a.m., should be more than enough time for the exam. If there's any technical difficulty, again, you have my phone number. Please use it. Question?
Yes. How long after we finish the exam you have the time limit for us to email you?
Like you almost instantaneously, because if you've been taking the exam, maybe on a scrap piece of paper, you write down 1 through 50 and write down all your answers. You could type me in a minute all the answers. So by 10:15 a.m. there should be an email to me with your answers, because an hour and 50 minutes is more than enough to answer 50 items multiple choice. A typical 50 item multiple choice with four choices, 4 to 5 choices, should take anywhere from 23 seconds to 35 seconds per question. And so when you do the math on it, you could finish it in half that time. But I allow 1 hour and 15 minutes for you to get that email. And that's assuming you start at 9 a.m. promptly, right? But if you're late, that's going to eat at your time. Okay. So does everyone understand? By 10:15 a.m., I should have an email from you with 50 numbers, with 50 letters. And make sure, don't leave any blanks. Because there's only one answer per question. Sometimes I see stuff like this, B and C. No, that'll be automatically wrong. That'll be automatically marked wrong because there's only one answer. It's not both. And if it's a blank, that will automatically be marked wrong. Remember, don't skip, and make sure please, because there's always one every term. Make sure all the numbers and the letters align, because all it takes is for those of you who maybe skipped a number and then went back. Make sure before you send it, it just takes an extra minute or two that all the answers match up of what you want to submit. Does anyone have any questions on how next Monday is going to go down?
Yes, can I ask you a question?
Shoot.
Are we writing the answers on a blank sheet of paper and take pictures of that and
No,
email it?
like I stated, do not send me any pictures. One way you could take the exam is it's on a Microsoft Word document. You open up the document and there's questions. You could, on a piece of paper, write 1 through 50 and write all your answers. And then you email me, whatever the answers were. So I wrote, just transfer it, just one. Oh, I think 1 was B, 2 was D, 3 was, and then just make sure, because all I need is an email with 1 through 50 with the letters on it. I don't need the questionnaire. I don't need the original file. I don't need pictures or photos of your answers. I just need an email, and in the body of the email, you write your name, right? And then 1 through 50, and then your answers. Is that clear? Everyone, does everyone get that? Or how to
Got
do
it.
that? Got it?
Got it. Mhm.
Okay. And another trick that you could do it, like, for example, like, let's say this is the questionnaire, right? Here's another trick that I've personally done. I open up another document and I'll do this, and I move it, make it smaller. And then I just do 1, 2, 3, 4. And then as I'm answering it, oh, first one's B. And it goes, oh, second one's D. And third one's, and then just all the way down. And then you just do what? Check it. That's another way you could do it. And but again, and then when I'm all done, I could copy all this, right click it, copy it, and paste it onto your email, right? And then just send it that way. And again, if there's any technical issues that morning, or if your Microsoft Word isn't cooperating with you, I will be monitoring my phone all throughout the entire exam. Do not log into Zoom unless instructed by me to do so, because I want you guys just to just sit there, just you, and you're on the honor system. Yes, you could cheat. Anyone can cheat, even if it's on Zoom. But like I've always stated to students, you can cheat all day. I'll catch you, maybe. I won't catch you. That's not the point. The point is you won't know what you're doing in the real world, and someone will find out. And if you're cheating on a 100 level course, you really should reconsider your career choices. But I don't think there's anybody here on this call or in this class that'll do that. But you guys know how tempting it is for other classes and to do other stuff. And like I stated, the School of Nursing has a thing about cheating. That's why they're very, very serious about that plagiarism thing, because they caught way too many students. And when you're in School of Nursing and even other classes, they want you to have your Zoom on and facing your keyboard the entire time. Because and other courses have a closed server, meaning to say is you can only open one website at a time, and the only website that's open will be your exam. I believe that's how your T's is also formatted as well. But I don't need to tell any of you guys. You guys are pros. Cheating, you may not get caught today, but you're eventually going to get caught, and heaven help you if you get caught in the real world. I have so many horror stories of classmates of mine And you'd be amazed. You'd think, well, you're in medical school. Don't. He goes, why would you cheat? Well, if you have a $250,000 bill for your education, there's a lot of people who have go through a lot of pressure and don't want to lose all that money, because like I also stated in previous lectures, 444 medical students came in on day one. Only 68 graduated. It is that vicious and it's that hard, and they do very extreme things in medical school and to prevent cheating, but still, cheating is still present, unfortunately. That's why I'm super, super proud of my education, even though I didn't get the best grades. I'm super proud because I never once cheated ever. I think the last time I cheated, it was on a math exam in 5th grade, and I got caught, and it was a harsh lesson, and I don't want to repeat it. And it was really neat because my professor said the same thing, didn't get upset, didn't judge me or anything. He just said, he goes, then why are you in school? If you need to cheat to pass something, then why are you in school? There's no real purpose for you to be learning. But everyone here is to learn, and you guys need to know this stuff. What else is part of the scope? All abbreviations that we talked about. I could ask you a question about abbreviations. So that could be kind of like part of the definition. Chapters, I believe the first week was chapter 1 and 2. Okay, so any words that appear in chapter 1 and 2. The second week was the cardiovascular, chapter 5. The third week was, I believe, respiratory, which is chapter 4. And this week, we'll be talking about gastrointestinal, which is chapter 6. So it's like 1, 2, 4, 5, and 6. Those are all the medical terms and abbreviations that you'll be responsible for. Another thing that you'll be responsible for is I could ask if the word is singular or plural, and you could look those up in your notes as well. So that's my segue onto chapter 6, gastrointestinal. So let's talk about that and what words look good. When you look at the word gastrointestinal, gaster means stomach, intestinal, of course, means your intestines. So someone who is in GI medicine, which when I was a resident, that was way back when. That was one of my dreams when I was younger and had way more discipline than I do now. I always wanted to be in GI med. Because for those of you who know anybody who have any like Crohn's disease and irritable bowel syndrome and irritable bowel disease, I'm sure. What's going on with my browser? Okay. How's this? I'll do that. Do that. Okay, there you go. Okay, so chapter 6, GI, and who are the people in our neighborhood? That's gastrointestinal medicine, GI med. Now, if you're in GI med or GE medicine, gastroenterology, which is just like gastrointestinal. What is going on? What would happen if I go to chapter 5? Speed up my browser, but what if I did that? What does that mean? God, I love technology. Worst comes to worst, I will just present notes, but all right, let's try this again. I'm going to medical language lab. Am I in Firefox? Yes. Okay, now I'm here. I go to my ebook. Vital source, it comes up. Chapter 1, 2, 3, 4, 5. Let's go to our objectives. Maybe that'll be easier. There you go. So let's look at people who are in GI medicine, known as gastroenterologists, and they're experts at the digestive system. And that's what happens when we eat. When we eat, we digest things. Meaning to say is, my body doesn't really want the food. It wants things that are in the food, the minerals, all the stuff that you have to break down. And that's what digest means, when you want to break down things. And that's what the gastrointestinal system does. And the people who are in gastroenterology, they're really good at endoscopy. Scopy is the process of visually inspecting or viewing endo that's on the inside. So you could see how we could break these words down and easily can ask, what does it mean and what are the parts? So you have the upper GI, which is everything from the esophagus, well, kind of like this part of the esophagus from the stomach on up. And then you have the lower GI, which is everywhere from the stomach on down. So the small intestines and large intestines. And all of these, like your liver, your gallbladder, and your spleen, they are considered accessory organs. And the function is just to break down food. Everything from here to the end is to break down food. Now, the little byproduct of this system is also to get rid of anything that we don't want. So after I take all the things that I want, like all the nutrients, well, I have to get rid of it. And that's where we have the large intestine and waste products from your rectum and then out into your anus and to the toilet bowl. So let's talk about upper GI first, and it starts at the teeth. So of course, dentists deal with teeth. Orthodontist, ortho means straight. It's the prefix that means straight. So this looks like a beautiful question, like which of the which of the following parts is the prefix? Ortho. It goes, on this particular question, what does ortho mean? To straighten. So you could see how if you look at every single word that you ever looked at, you could pretty much predict my exam and get ready for it. So the difference between a dentist and an orthodontist, the dentist deals with diseases and disorders of the oral cavity, including your teeth and gums. Your orthodontist is specialty is to straighten your teeth. So you get braces, you get braces from your orthodontist, and the person who's going to deal with your cavities is the dentist. I don't like either of them. They are awful and they charge way too much. Just my opinion. I went to the University of Medicine and Dentistry. Up until year 2, all the dental students take the same classes as the medical students, and then they split. And then a lot of the doctors are very jealous of the dentists because once they leave school, they can make money. If you're an MD, once you leave school, you have residency, you have all these other things, and you don't make money for a long time. Gingivitis, itis, inflammation or infection of gingiva, which is your gums, which, by the way, gingivitis, we now know that the bacteria associated with gingivitis also leads to carditis, which is inflammation or infection of your heart, and also to heart failure and premature MI. So taking care of your teeth is really important. Tongue, glossal. So your hypoglossal nerve has to be the nerve under your tongue. We also have lingual, some lingual medication like nitroglycerin for chest pain, and ischemia, which is when your blood pressure starts backing up everything. And that's pertaining to underneath the tongue. So if you're ordered to deliver sublingual medication, that medication must go underneath the patient's tongue. Versus buccal, B-U-C-C-A-L, buccal means between, in your cheek, right? So buccal meds, you put it in your cheek. Sublingual meds, you put it underneath your tongue. You'll learn all of that in pharmacology. Oral, al, pertaining to, of course, your mouth. And we already discussed the root stoma. But in this term, stomatopathy is a disease process of your mouth. Your saliva, right? Tile. So tilism is a condition of what? Salivation. And usually when we say tilism, it's synonymous with sialorrhea or hypersalivation. So does not look like a beautiful all of the above question? Which of the following terms means too much saliva? A, tilism, B, sialorrhea, C, hypersalivation, D, all of the above, E, none of the above. That's a nice thing that you can group together. Your esophagus is your food tube, and we could scope my patient. I use the esophagus scope when I have a scheduled esophagoscopy, okay? Scopy is the process. Scope is the actual instrument. I also could scope the throat, which is a pharyngoscopy. I might see pharyngotonsillitis, but I don't need to scope somebody to do that. I could use a pen light to see that. But it's also nice. Maybe it's really deep and back in the back part of the throat. Let's say, for example, I'm suspecting cancer or something like that. When I scope the patient, we can also get samples in the form of a biopsy. Gastroscopy, okay, that's we do that for your stomach. Pylorotomy is to make an incision in your pylorus. Now, what's a pylorus and what's a sphincter? Let's look back here in our stomach. Our stomach and all of these things, they have doors that open and close because, for example, the stomach has a pH of 1. That means it's highly acidic, and we don't want that acid to leak all the way into the small intestines and damage it. We also don't want that acid to leak into the esophagus and damage it like you would get in heartburn or GERD, which is gastroesophageal reflux disease. So we have these things called a sphincter. And all a sphincter is a valve. It's a pretty much like a purse string. Let me show you. Well, I don't want to show you the actual surgery. I just want to show you when you look at a sphincter, what it really is. If they can look at it. Oh, here you go. If you see this, and this is an endoscopy, you see how there's muscle all around this? If the muscle all tightens up, this will close like a door. And you could see here, your esophagus or your food tube is connected to your stomach, and this is your cardiac sphincter, also known as your GE or gastroesophageal sphincter. Sometimes they call it the lower esophageal sphincter, right? You'll learn all that anatomy and physiology. But if you had GERD, gastroesophageal reflux disease, gastro, stomach, esophagus, food tube, reflux disease, that means the acid here keeps on kicking up into here. If you drink a lot of alcohol, high fat, high salt diets can do that to you. Especially alcoholics, the acid starts kicking up here and it starts wearing away at the lining of the esophagus. And then you get this cancer called Barrett's, hence the term Barrett's esophagus. Here's your pyloric sphincter. You could see how, like if it was a string around it, it could get tied off like this. And your pylorus is the sphincter here, and it goes, it's the door that closes between the stomach and the first part of your small intestine, which is called your duodenum. And if you recall, the suffix um stands for structure of. So the first part of your small intestine is called your duodenum. Then you have other parts, and we'll show you those in a second. Algia, gastralgia, pain, gastrodynia, also stomach pain. Doesn't that look like a beautiful both A and B? Hyperemesis. How about hyperemesis gravidarum? Gravid means pregnancy. Hyper, too much. Emesis means vomiting. Hyperemesis gravidarum is also known as morning sickness. But I believe those of you who've had morning sickness probably would like to call it morning, noon, evening, and whenever it's totally inconvenient sickness. And that's what hyperemesis is. It's too much vomiting. Gastromegaly, you could also have enlargement of a stomach. It is a muscle, so if it's getting infected, or maybe you're just eating way too much, you could have gastromegaly. Anorexia, that means lack of appetite. Ia, state or condition. An means no or not. Orex means to eat. Now, anorexia doesn't necessarily mean it's psychological causes, because maybe you heard of the term anorexia nervosa when a lot of people, for whatever reason, they don't want to eat, so they kind of starve themselves. But anorexia in the typical term just means that my patient has no appetite for whatever reason, pain, or they're just not feeling well. Because when you're sick, or if you have side effects of certain medications, you don't want to eat anything. Dyspepsia could also lead to anorexia. Dyspepsia, ia, the suffix meaning state or condition. Dys is the prefix that means bad, painful, or difficult. Peps means digestion, how the food's going down. And if it's dyspepsia, you can have bad indigestion. Dysphagia, it could be bad or painful or difficult swallowing or eating. These are typical signs and symptoms that you'll see in a gastrointestinal patient. And last on this particular page, diarrhea. Rhea is the suffix that means discharge or excessive flow. Dia, and we already know from diagnosis, means complete or thorough. I don't like this definition of the this modern version of this book, because through and across means trans. Doesn't mean dia. Dia means thorough, means complete. And when you get diarrhea, and that's why we're kind of wary of it, we pay attention to it, because if my patient is very old or very young, they can easily get dehydrated very, very easily, because what's flowing out into the toilet? Dia, complete or thorough. That means all the nutrients are flowing out into the toilet, and all the water is flowing out into the toilet. And that's what makes diarrhea kind of dangerous. I've had several babies where the diarrhea, several infant patients where the diarrhea wasn't properly controlled, and the babies died, unfortunately. All this is good. Already went through these. These are good. Sublingual, we already talked about, but submandibular, that's underneath your mandible or underneath your jaw. It's one of those your salivary glands. Osis, of course, we always know that's abnormal condition. So stomatosis, abnormal condition of your mouth. It could be a fungal infection, it could be viral, it could be a whole bunch of things. And here's a fungal infection, stomatomicosis. Osis, abnormal condition of stomach, mouth. Myco is fungus. And mycotic infections, especially of the mouth, maybe you've seen it. It's called thrush. Here's a picture. For immunocompromised patients and or patients who are on a decent amount of corticosteroids, an example would be asthmatics, and then they get this stuff. And it's a yeast infection, see? And sometimes you scrape that down and it starts to bleed a little bit. And that's what's called thrush, also known as stomatomycosis, or just simply mycosis, abnormal condition of fungal or fungal infection. Another mycoses, plural, athlete's foot. Get that same, like, that white stuff. What else looks good? Peptic ulcer disease, PUD. So that means my stomach. Typically my stomach is going to have a hole in it, and that's not good. It's usually because of this bacteria called Helicobacter pylori. And how do I know this is a bacteria? It's the first name is capitalized, and the second name is lowercase, and it's italicized. H. pylori is a definite cause of PUD. Mucus, that's what prevents the lining from wearing away because of the acid. So when you get a gastric ulcer, the lining wears away and then you get a hole. And like I stated earlier in this lecture, you get it from like alcoholism or binge alcoholism, which now, according to the new criteria, is the same thing. And people high salt, high fat diet. Oh, when I was in medical school, I used to get this a lot until I had it. I used to get GERD a lot until I had an ulcer. That was not fun. And of course, you can get ulcers because of stress. I was barely 3 months into my first year in medical school when I got an ulcer. Well, rather get an ulcer than neuroses, anything to do with the nervous system. Now, this is the lower GI. So small intestine. I mentioned earlier that the first part is called your duodenum. The second part is called your jejunum. And the last part is called your ileum. There's 3 parts to your small intestine. And typically, when we say the word entero, an example is enteropathy, we typically mean, enter means intestines or intestines in general. So if my patient has an enteropathy, we're thinking intestines in general, but most likely small intestine. We could scope, do a duodenoscopy, say that 8 times fast. I could also suture things up, jejunarorrhaphy. Ugh, still can't say that. And we could create a stoma or a connection to the outside world in an ileostomy. And I'm going to show you a picture in a moment. Why in heaven's name would I want to create a hole in your small intestine? Okay. Appendectomy, of course, I'm going to remove the appendix. The appendix, let's look at the picture. Where's the picture? In your large intestine, also known as your colon, there's a little vestigial organ, piece of the organ that sticks out. And by the word vestigial, it means that we don't really use it anymore. But the problem is if something gets lodged in there, and usually a fecalith, which is a stone-like piece of feces, gets lodged in there and then gets infected, this will grow. And we're not really too concerned about the appendicitis and the pain associated with the appendicitis. I'm more worried about if this bursts and all the feces or the waste matter starts going into your peritoneum, which is the covering of all this, and then you get peritonitis, and that's bad news. You could easily die from that or go into shock. That's never fun. Had a 13-year-old 13-year-old girl who got they misdiagnosed, they missed the diagnosis of appendix, and I saw her in the morning, like 10:30. I went back at 8 o'clock and no one did anything to her. And she was just suffering for all those hours. And then it burst. And then she had a surgical abdomen. Ugh, it was just awful. So that's your appendix. Appendicitis, I want to perform an appendectomy. I remove the appendix and then I tie it down with a purse string suture. Should take you 20, 25 minutes tops. Colostomy, yet another opening, but now this one is in the large intestine. And typically, when they say colon, they're talking about the large intestine in general. And if I'm performing a colonoscopy, also known as a lower GI series, right? I am scoping the large intestine. Your anus, also known as your rectum, the proctologist is the subspecialist. So you already have the specialty of internal medicine. Then you go into your subspecialty of gastrointestinal or GE med, and then you take proctology on top of that. And so these are super subspecialists. And the anus and the rectum is the last set of sphincters in your large intestine. You could have a rectocele, common in patients who had a lot of children because the pelvic floor starts to get weak, and you could have a herniation or a protrusion. That means your rectum, which usually is up, will stick out, and that's not good. Sigmoid colon is the part of your colon, part of your large intestine, and we could also scope that as well. And while we're scoping and we see something that we don't like, or we have to open something up, we could perform a sigmoidotomy. And remember, tomy, I'm just making an incision. I'm not taking anything out. But if I see cancer, if the biopsy comes back bad, or it says it's cancer, then I must perform a sigmoidectomy and remove that part. Where is the pictures? That's what we want to see. Oh, so this is a colostomy bag. So why would I do this to somebody? Well, let's say, for example, my patient here had a rectal carcinoma. That means they had cancer of her rectum here, which is the last part of the tube. And this is the anal sphincter here. There's two of them, right? So if I had cancer here and I did surgery here, I don't want feces to be messing up with my wound care that's down here. So what do is I cut this, close it off, and this part here will be connected into an external port into a colostomy bag. So I create a stoma so that it bypasses all the feces to go into the bag and not into here on down, because I want this area here to heal first. And hence, this procedure is called a colostomy. Baby with pyloric stenosis, you can see this poor baby's pylorus got narrowed. This is a lower GI series, also known as sigmoidoscopy or a colonoscopy. Where am I going? I'm going through the anus here, and then we could visualize things. If I see a polyp, I could remove it, perform a polypectomy, and / biopsy, because sometimes that polyp could be cancer. Your myenteric plexus, and of course, every time you see green, you also know that there's a lot of lymphoid tissue here in your intestines, because it's dirty. It's got a lot of dirty, nasty things in it. This right here, let's slow it down, because this is, in medical terminology, this page right here always gets you guys. So, and it's also that not all of you had anatomy and physiology. So let me show you what your gallbladder looks like and what does it do. I know I promised in the beginning that I wouldn't do an anatomy and physiology lecture for this class, but we really need to because you got to know what the gallbladder is and what all these little tubes are. And it's situated on the inferior aspect of your liver. So you have, of course, your gallbladder. Your liver makes this stuff called bile. And bile is an emulsifier. It means that it breaks down fat. And it makes sense. If I'm eating, I'm going to have a lot of fatty stuff coming out of my stomach. So it here in the duodenum. So I'm going to need something to break down all that fat. So your body stores all that bile in your gallbladder. And then you have a common bile duct, and you have all these different ducts or pathways, and also connects into the pancreas as well. So now that you know what the gallbladder is, where it is, and what does it do for you, I could have a very small bile vessel. You know how in this picture it got smaller and smaller and smaller? This is a cholangiole. These little tiny branches. It is a bile vessel, or a terminal or end piece of your bile duct. You could have a gallstone, a cololith. The suffix lith, of course, means stone. I mentioned the term fecal lith earlier. That is a stone or a calculus made out of feces or waste products. Your gallbladder itself, the combining form for it is cholecyst. So if I perform a cholecystectomy, I am cutting this out. That's a cholecystectomy. I'm taking the gallbladder and I'm removing it. And if I have a cholecystectomy, my patient could no longer have any fatty foods. I had a student a couple terms back. She was status post cholecystectomy. Oh, by the way, I use that term status post. You will see it written like this. Or S/P. That means it's post, means it's done. So status post means past medical history. My patient or my student had a cholecystectomy in the past. Now, you could also have the main bile duct. I have to open it up sometimes because maybe there's a cololith in there. So there's an incision of the common bile duct, and that's called a choledochotomy. So this is your main bile duct. There's a stone in it. I just got to cut it so that we can release the stone. And that's a choledochotomy. Hepatitis, of course, inflammation or infection of your liver. That's bad news. Your liver performs 5 major metabolic functions in your body. That means when you have hepatitis, it's going to break down, and that's not good. Pancreatitis is almost a death sentence. Inflammation or infection of your gland of your pancreas. And your pancreas is big time useful in metabolism, especially regarding insulin and glucagon. And we already know that insulin is very important to us in taking in glucose. And if you have pancreatitis, inflammation or infection of the pancreas, the pancreas starts releasing enzymes that it doesn't mean to, and it starts breaking down things. And one of the first things it starts breaking down is your heart. So there's a lot of cardiac complications to pancreatitis. I had a classmate of mine. He was in his early 20s. He died first year of pancreatitis. And all he complained about was left upper quadrant pain. It was around 8:30, 9 o'clock. He said he was going to just take a nap. His brother found him at 5:30 in the morning in his bed, deceased. And the autopsy stated it was pancreatitis. I'll remember that day, the end of my days. It's rough when you're doing CPR on not only a friend, but a colleague. He was awarded a honorary MD to the family. Cholelithiasis is a stone in your gallbladder, cololith. Hepatomegaly, right? Process, mega, getting big of my liver. You don't want hepatomegaly. It's not good. It usually indicates hepatitis or the beginnings of the destruction of alcoholism onto your liver. Preprandial versus postprandial. Preprandial means I got to give meds or I have to do something before my patient eats. And postprandial, you have to do something or give the meal. I'll give something after the meal. Please pay attention to this. It's so easy to mess up. And how many times have I had other medical professionals mess up my patient because they didn't take the test at the right time or they didn't give the meds at the right time? Many times that we give postprandial meds because it increases the acidity of your stomach. Man, every time I forget to take my colchicine, I forget to eat before I take my colchicine, oh, my GERD kicks up and I get really, really bad heartburn. Lovely diagram, if you're studying for anatomy and physiology. That we went over. Oh, here's some stones, right? You can see why I need to cut them out. It'll block everything. And cholelithiasis, we went over that. Oh, toxicology, or a tox screen for slang. Logi means study of, toxic means poison. So a toxicology screen is common poisons that are that are in your body. It doesn't screen for everything. That's what a screen does. It's a wide array of things that we could test for, but it doesn't test for everything. Toxicosis, abnormal condition of poisons in your blood or wherever in your body in general. What abbreviations I like? BE, yeah, sometimes I use that, not as common, but BM, we use that all the time. Bowel movement, meaning my patient is passing feces. We need to know that. We need to know amount, time, consistency, and you'll learn all that in your med surge. BMI is body mass index. We don't really use that anymore to calculate obesity, but it's a nice thing to monitor. Because if we used BMI now, like 90% of Americans would be considered class 1 obese. CA, always cancer or carcinoma. CT, DX is diagnosis. EGD, I've heard it a couple of times, but can you take this 25-cent word and break it down? Esophagogastroduodenoscopy. Don't you think that'd be a great question? Great all of the above question? Goes, I scheduled this, an esophagogastroduodenoscopy. What did we scope? Did we scope A, person's food tube, B, person's stomach, C, a person's small intestine, or D, all of the above? And of course, it's all of the above. ESWL is extracorporeal shockwave lithotripsy. Now, another 25-cent word, but what does it mean? Extra means the prefix that means out of. Corpo means body. Al pertaining to, or AL pertaining to. So pertaining to, out of body. The machine sends shock waves from outside of your body so that it can do the process, tripsy, of breaking down litho or stones so that the patient can pass the stone. FBS or FBG, fasting blood sugar, also known as a fasting blood glucose. GERD, gastroesophageal reflux disease, we went over. GI, gastrointestinal. GE, gastroenterology. IBD and IBS, very, very common. Inflammatory bowel disease, inflammatory bowel syndrome. IV, very common, intravenous. I could give you meds and fluids via IV. LES, that's also common, lower esophageal sphincter, also known as your cardiac sphincter. And hence, that's the term, when that stuff starts to fail, that's why they have the term heartburn. It's not really your heart is burning. It's just that the acid is kicking up in the lower esophageal sphincter area, which is right behind your heart. MRI, magnetic resonance imaging. NG, nasogastric, or NGT, nasogastric tube. OR, operating room. PUD, peptic ulcer disease. Now, RGB, it's common, but in probably only in surgery, and that's called a Roux-en-Y gastric bypass. Now, what does that mean? Ick, pertaining to gaster, is your stomach, and I want to go around it for whatever reason. Let's say there's cancer, I want it to heal up, or for a multitude of reasons. So I perform an RGB. The quadrants of your stomach are also labeled. Let's look at the quadrants. I believe this is a quick review of your chapter 2. RUQ, LUQ, LLQ, RLQ, right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. This is like the easier way, but you are also responsible for this as well. Don't you think I could easily do this? How's this quiz or this on the exam? La, 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 la. Think I could do this to you? Easy. Which one's umbilical? Which one's right hypochondriac? It goes, which one's left inguinal? Okay. Or I could do this to you. Which one is right upper quadrant? And remember, this is your patient's right because you're looking at your patient, and this is your patient's left. So the right upper quadrant is 1, left upper quadrant 2, left lower quadrant 4, right lower quadrant 3. I can do that to you. But honestly, I'll most likely do this to you, this one. Because it clearly shows that if you know what these medical terms actually mean. Epigastric, above the stomach, on top of, hypogastric, underneath, hypochondriac, hypo meaning below, chondr, ribs, lumbar or your loin, which is your waist, your iliac, pertaining to your ilium, which is your hip bone, which is right here. Ultrasound, of course, ultrasonography. Ascites, that is massive amount of fluid collection in your peritoneal or abdominal cavity. That's not good. Borborygmus, that's that gurgling or rumbling sound. We actually count these sounds when we put the stethoscope on your stomach. Cirrhosis, chronic liver disease, typically with alcoholism, but it could be also caused by other things. And this is ascites fluid. We got to get it out, put a catheter in you and get it out. I don't want to go into pathology. Here's a barium enema. You see, this is before. It goes, and this is after. So what does barium do? You can see how it kind of outlines everything. And you could see little better things here. Like this is potential stricture. I don't know what this is. This could be a polyp, that kind of thing. Laparoscope or laparotomy. Tomy, to cut into. Laparoscope. I want to scope the abdominal area. We do this if we want to inspect that area. Something is and this is bariatric surgery. Here's Roux-en-Y. We want to bypass, and also known as a gastric bypass. But I can tell you, this is me medically. There's no bueno. I don't like it. Antacid are medications that are anti or against acid. Anti-diarrheal, that's a medication that's against diarrhea. Antiemetic is medication that's against vomiting. Okay, so that's a nice question. H2 blocker, that's for GERD, and a laxative, of course, to relieve constipation. because ugh, constipation is just as bad as diarrhea. Okay, and we'll talk more about these cases next week. So that is the entire chapter. Does anyone have any questions? I will now stop the video, and there'll be 2 videos, of course, but focus on